Well, the FDA says counterfeit Botox caused an outbreak of botulism-like illness in 9 states. Federal regulators say at least 19 people got sick, including 9 of them requiring hospitalization. The FDA is now working with the maker of Botox to remove those counterfeit products. And Dr. Zakia Rahman is a dermatologist at Stanford Health Care. So, doctor, first, what exactly is botulism and how serious is it? And what are some of the symptoms?
Hi, Ryan. So botulism is actually a disease caused by botulinum toxin, which is the most potent toxin known to humans. And botulism can actually occur in nature in specific populations, such as newborn infants, and those who have wounds, like people who get motorcycle accidents or inject IV drugs, and also those who ingest food that's been improperly fermented or packaged. In this case, this was from counterfeit Botox that was injected in a non-medical setting. And the symptoms of botulism can range from mild to life-threatening and can start within hours of injection, but even after weeks because of the mechanism of the toxin. And these symptoms include double or blurry vision, droopy eyelids, difficulty speaking, difficulty swallowing, difficulty breathing, and even generalized weakness.
Do they know where that counterfeit Botox is coming from?
The current reports from the CDC and the FDA, actually now the cases are up to 22 patients, and we're not sure about the sources, but as a board-certified dermatologist who does these procedures all the time, and I saw an image of the box, it was very obvious to me that this was a counterfeit product.
So if you think Botox could have been injected incorrectly, so what are, you had kind of mentioned some of the side effects, but what are some of the side effects that we should look for?
So it's important to remember that this is the most common aesthetic procedure that's performed in the US. There are about 4 million of these procedures that are performed every year. And as people live longer, the number of these procedures is just going to continue to rise. And when done safely in a medical setting by the FDA-approved products, it is extraordinarily safe.
Okay, so if you're thinking about getting Botox, what should we be looking for? How can you tell if you're getting a counterfeit or the real thing?
I would say that as a consumer, one is understand the credentials of the person that's treating you and don't make something that's a medical treatment non-medical. Do it in a medical setting by somebody who's a licensed practitioner, such as a physician who specializes in aesthetics, like a dermatologist, facial plastic surgeon, ophthalmologist, or plastic surgeon, or also a nurse or an advanced practice provider. These people actually have licensure. Speak to the person that's injecting you, make sure they go over the informed consent. And if they're not willing to do that, don't have the procedure, which could potentially be life-threatening.
Yeah, definitely stay with people who are licensed and certified. So Dr. Zakia Rahman with Stanford Health Care, always good information. Thanks for joining us.
Thanks for having me, Ryan.